Let's paint a picture for a second. You're home, totally alone, and then it hits you, this crushing weight on your chest. Your arm feels numb, and you can't seem to catch your breath. You realize you're having a heart attack, and there's no one there to call for help. It is an absolutely terrifying thought, but it's a situation you can survive. That is, if you know exactly what to do.
So let me ask you straight up, if this were to happen to you right this minute, would you know the first steps to take to save your own life? Because what you choose to do in those first few minutes, well, it can literally be the difference between life and death.
And don't think for a second this is some rare one in a million scenario. Every single year, more than 380,000 Americans have a heart attack while they're completely by themselves. The odds are you or someone you care about could easily face this exact situation. But this is where the power of just knowing what to do becomes incredible. A really groundbreaking study in the European Heart Journal found something amazing. Just knowing the correct steps to take, the right sequence of actions in the first 60 seconds, increases your chances of survival by an astounding 73%. That is a massive, life altering difference. Okay, but here's the really shocking part. That same research, it revealed that a staggering 89% of people over the age of 60 have absolutely no clue what those correct steps are. They freeze up, they panic, or even worse, they do things that actually make the situation more dangerous. So today, right now, we're going to fix that. All right, let's get right into it. We're going to start with the essential prep, the stuff you can do before a crisis ever hits. Because trust me, being proactive is your single greatest weapon here. And this right here, this quote, it perfectly highlights the very first problem. The paramedics show up, lights and sirens, but they can't get to you. One study that tracked thousands of these emergencies found that a simple locked door delayed life-saving treatment by an average of 11 minutes. When your heart is literally starving for oxygen, 11 minutes may as well be an eternity. So, this leads us to a protocol that might sound a little backwards, but it is absolutely critical. The second you feel those symptoms, before you even pick up the phone to call 911, your first job is to get to your front door and unlock it. Then flip on all the lights you can. Why? Because the average person loses the ability to walk within just 3 to 5 minutes of a major cardiac event. Once you're on the floor, you're not getting back up to let help in. Now let's build on that. When your brain is deprived of oxygen, something as simple as remembering your own address can become almost impossible. In one study, 67% of callers couldn't do it. So you need to set up your emergency system right now. Tape your full address to every single phone in your house. Put 911 on speed dial. Keep your cell phone charged and always within reach. And if you have a medical alert device, please wear it. Yep, even in the shower. Okay, so you've done the prep work. Help is on the way, and crucially, they can get inside to reach you. Now let's talk about what you can do with your own body to physically buy yourself precious time. These are techniques to keep blood flowing and help you stay conscious. First things first, your body position is critical. Whatever you do, do not lie flat on your back. Instead, you want to get into what doctors call the semi-Fowler's position. Basically, sit up against a wall or prop yourself up with pillows at about a 45-degree angle and keep your knees bent. This uses gravity to literally reduce the workload on your struggling heart and makes it easier to breathe. A study out of Tokyo Medical University found this position alone improved oxygen saturation by 35%. Next, you have to fight that overwhelming urge to hyperventilate. Panic breathing just makes everything 10 times worse. Instead, you're going to use this controlled method. Breathe in slowly through your nose for a count of 4, hold it for 4, and then exhale very slowly through pursed lips for 6 seconds. That long exhale is key. It actually activates your body's calming system, which slows your heart rate and lowers your blood pressure. Stanford researchers even found that patients who did this had 45% less heart muscle damage. Now, you might have heard about this one, cough CPR. Let's be really clear. This is not a fix. It's a bridge. It's a temporary measure. If you are still conscious, you can take a really deep breath and then give a hard cough, deep from your diaphragm. You repeat that every 2 seconds. This action manually squeezes the heart, and it keeps just enough blood flowing to your brain. It could buy you an extra 90 seconds of consciousness, which might be just enough time to unlock that door or grab your medicine. All right, let's move on to the medicine cabinet. When you're having a heart attack, taking the right medication is obviously vital. But what's really amazing is that how you take it can be the thing that truly saves your life. Let's start with aspirin. We've all heard you should take an aspirin, but here's the game-changing detail that most people miss. You must chew one 325 milligram non-coated aspirin. If you just swallow it whole, it has to go down to your stomach and dissolve. But when you chew it, it gets absorbed directly through the lining of your mouth right into your bloodstream. And look at this difference. Chewing gets it working in 14 minutes, swallowing takes 26. When your heart muscle is dying, those 12 minutes are absolutely everything. Now we come to what might be the single most powerful tip in this entire explainer. A Harvard Medical School study found something just incredible. Patients who used emergency nitroglycerin and used it correctly had survival rates that were almost identical to patients who had a paramedic standing right there in the room with them. It's that powerful. So if you have any cardiac risk factors at all, you need to talk to your doctor about getting a prescription. But notice I said correctly. That's the key word. So it's crucial you follow this protocol to the letter. At the very first sign of symptoms, you sit down and you place one tablet under your tongue. Do not swallow it, let it dissolve. If your symptoms are still there after 5 minutes, you take a second one. After another 5 minutes, you can take a third. But that's it. Never ever take more than 3 tablets in a 15-minute window. And finally, a few safety rules here are absolutely non-negotiable. Always sit down before you take it because it can cause a really rapid drop in your blood pressure. You have to store it in its original dark glass bottle, and you need to replace it every 6 months because it loses its potency. And this is critical. Never take it if you've recently used any erectile dysfunction medication like Viagra or Cialis. That combination can be fatal. And for the best possible result, chew your aspirin first. Phew. Okay, so we have covered a ton of really critical information here. So let's pull it all together now into a clear, simple, life-saving action plan that you can start putting into place today. Here it is. This is your homework. This is your preparedness checklist. Today, set up that communication system with your address taped to the phone. Make an appointment to talk to your doctor about nitroglycerin. Go to the pharmacy and stock up on uncoated aspirin. Practice that 4-4-6 breathing so it becomes second nature. And talk to a trusted neighbor or family member and give them a key. These aren't things to put on a to-do list for next month. These are things to do now. Why is all this so important? Because this number, 8 to 12 minutes, that's the average emergency response time in the United States. The techniques we've just gone over, every single one of them, are designed to keep you alive and minimize the damage to your heart during that critical window. In those first moments, you are your own first responder. So now you have it. You have the knowledge that 89% of people are missing. You have the information that can boost your chances of survival by 73%. The only question left is, what are you going to do with it? What is the one step you will take today, right after this, to get prepared? I think your heart and the people who love you will thank you for it.